A good candidate for a penile implant is a person that has failed medical therapies or a patient that wants to be more spontaneous or wants to be very on demand for their sexual encounters and don't want to have to wait for a medication to work. Many insurances do cover the procedure. However, there are insurance carriers that do not, and we will just need to look into it, whether or not your insurance carrier will cover it. There's two basic types of penile implants. One is a malleable and one is an inflatable. The difference between a malleable and an inflatable is that a malleable is always hard and bends, and it's typically one component, one rod going to the penis. An inflatable penile prosthesis is multi-components. It inflates and deflates, meaning you can get erect and hard and flaccid and soft. And so it reproduces physiologically what's happening, and it's much more natural feeling and much more normal feeling to the patient. The implants are sized in the operating room. We use measuring devices on stretch, and we give the patient the longest penile prosthesis we can. The inflatable penile prosthesis is operated by having a pump in the scrotum, and then there's a reservoir, typically in the abdomen cavity, where fluid is transferred from this reservoir into the penile implant by the pump. The malleable is just bends like a pipe cleaner. Whatever you had before the surgery typically is what you'll have after the surgery. So if you were able to have normal sensation and normal ejaculation, placing the penile implant should not affect that. However, if you were not able to have ejaculation or you had difficulty with sensation, the surgery is not going to help or improve that. The implant is concealed completely. Nobody's going to know you have an implant. If you're in the shower in the locker room, no one's going to know. I've had even some partners never know that their spouse had a penile implant. The implants are made of a medical grade proprietary polymers. Specifically for the Titan, it's made of Bioflex. If you have an inflatable penile prosthesis, the fluid inside the implant that is being transferred and causing the erection is saline. The penile implants, depending on the type of implant, can be there will be different incisions. For the inflatable penile prostheses, the incisions will be typically a small incision above the pubic bone or a small incision in your scrotum. And if it's a malleable prosthesis, typically it'll be a small incision right below the head of your penis on the sides. 2 incisions for that one. The recovery is pretty short. You won't be able to use the implant for about 2 months. You can use the implant in about 2 months. The penile implants for the inflatable should last 15 to 20 years. The malleables, a little longer. Satisfaction rates for penile implants have been high as 90%. So the number one risk for a penile implant is infection, and we do everything we can to prevent that. Antibiotics, doing it quite sterilely, and a good skin prep. Other risks include erosion over time. The penile prosthesis can erode outside the penis or into the urethra, and it can malfunction.